You're too cheap.
This is, talk about, is there anything easier than the length-based tape for pediatric cardiac arrest? And we've got the PowerPoint up on the screen. So, it's 3 a.m. You are sound asleep on shift, and the tones go off. Dispatch tells you that you need to respond to 123 Main Street reference to a cardiac arrest. So you rush to the scene, and as you exit your ambulance, 1 foot out of the door, dispatch comes back and tells you it's a 1-year-old. Warm to the touch, not breathing, no pulse. Okay. So where is our stress factor at? Through the roof, okay? So what I want to tell y'all about is what is easier than using a length-based tape? A length-based tape that we have used for years, okay? That is very common. Okay, so I want to talk about our current method and a new method. So I'm going to try to show you a little bit of evidence and proof and make you believe that this is a better system. Compare so you can draw conclusions on your own and hopefully relieve some emotional stress whenever you are dealing with a cardiac arrest on a pediatric patient. So it may make it a little bit better for you. Okay. So the current method, length-based tape. So you arrive on that scene, 3 o'clock in the morning, 1-year-old cardiac arrest. So we go in, we start our assessment that we're going to use on our patient. And in that assessment, we need to retrieve our length-based tape from our pediatric bag. And first, you got to try to remember 3 o'clock in the morning, where's the length-based tape? Okay. So you finally dig it out, 20, 30 seconds have gone by. You unfold it, and now you got to measure the patient, right? Big, long unfold, nice color-coded, pretty ooh-ah. Right? So we got to place it on our patient, we've got to measure. Right? Once we measure, we find out a color that this falls into. So once we do that, then we got to read the medication information. Now with length-based tape, there's a lot of information. There's stuff on both sides. So you got 2 different sides. You're trying to figure out what do I need to give, what do I need to do, and you're trying to decipher all this stuff at 3 in the morning, which makes it very, very difficult to do. So once you do that, you find out I need to give this medication. Now what do we have to do?
Draw it up.
Right, draw it up. We've got to get that medication out. So now we got to perform some medication math. Now, what is one of the biggest problems with pediatric cardiac arrest and medications? Weight-based. They are all given by weight. So now we're trying to figure out how much this kid weighs by using our length-based tape, and now we've got to do math in our head. All right, 3 o'clock in the morning is tough to do, much less regular daytime. All right. So, what is a better way? A simpler solution to this problem, and it's very simple. Is a hand. So how can a hand be simpler? All right. Well, I'm going to teach you a very, very simple process, and I'm going to give you a handout that shows about it as well. So everybody hold your hand up. Class participation. Okay. And starting with your thumb, 1, 3, 5, 7, 9. 1, 3, 5, 7, 9. Okay, muscle memory, 1, 3, 5, 7, 9, 1, 3, 5, 7, 9. Those are your year and age. 1-year-old, 3-year-old, 5-year-old, 7-year-old, 9-year-old. Okay? Now, second time through, starting with the thumb, 10, 15, 20, 25, 30. That is your weight in kilogram on average for that age. So a 1-year-old should be roughly 10 kilograms. A 3-year-old, 15 kilograms. A 5-year-old, 20. A 7-year-old, 25. And a 9-year-old, 30. Okay? So what do we do for the in-between ages?
In between number.
In between numbers. So say we have a 4-year-old. All right, you got 1, 3, 5, 4 falls in between. So we've got a 20, between a 15 and a 20 kilogram. What's half? 17 and a half, 18 kilograms. You've got your weight for your 4-year-old. Do the same thing for a 6, for a 8-year-old, and then 10-year-old, you can go somewhere around 35 to 40 kilograms and you'll be fine. 2-year-old, you would fall at 12 and a half, 13 kilograms. All right, does that seem simpler so far? A little bit quicker than looking at this chart. All right. Now I've got the handout I'm gonna pass out that shows exactly kind of what you're seeing up there. And I wish I could take credit for finding this, but I didn't come up with it. It's called the hand-heavy method. And that is what your handout is, so I give credit for that. I do have it referenced at the end of the presentation. So, what common medications do we typically give? Go ahead and give you three. Three you really need to think of in cardiac arrest. Epi is one of them.
Atropine.
Not atropine, but normal saline. Okay, fluid for your hypovolemic patients. What is the dose for it? 20 per kilogram, right? It's by weight. The epinephrine, which is 0.01 milligrams per kilogram, and then Narcan, right, for our narcotic possibilities. And that's 0.1. Now, one of the jewels of this system, you're going to find out where it easily translates is in your math. It'll be very simple in doing your math. Instead of getting in the back of the truck and trying to do this math, try to figure this, divide this, the way we've always learned, this method is so much simpler. So with normal saline, you need to remember 5 numbers. Okay? I'm giving you a lot of numbers, but you got 1, 3, 5, 7, 9, 10, 15, 20, 25, 30. Now you need to remember 2, 3, 4, 5, 6. That simple. A 10 kilogram patient gets 200 milliliters of fluid. A 15 gets 300, a 20 gets 400, a 25 gets 500, a 30 gets 600. That's simple and quick on your saline. So if you have that 1-year-old, you start your IV or your interosseous, you hang a bag of fluid. How much fluid do you need to give? So 10 kilogram, 10 times 20 is 200. Remember 2, 3, 4, 5, 6, that's your fluids. 200, 300, 400, 500, 600. All right, all the way up to a 9-year-old. All right, split the difference in the middle. So if you've got say a 2-year-old, you're going 200, 300 in the middle, 250. That quick and simple. Epinephrine, our common math for it, 0.01 per kilogram. So we use that 10 kilogram patient, multiply it, now it's 0.1. Okay? Commonly packaged 1 milligram and 10 milliliters. We do our math here, our volume on hand times our desired dose divided by our dose on hand, we get 1 milliliter. So for a 10 kilogram, it's 1 milliliter. Okay? You have 10, it's 10.0, right? Move the decimal back 1 milligram. Guess what it's going to be for a 15 kilogram? 1.5. 20 kilogram? 2. 25 kilogram? 2.5. And a 30? 3. How quick is that? So much simpler in the field. Narcan, 0.1. It's a different dosage. Okay? A little bit stronger dosage than what the epinephrine is, but doing that 10 kilogram patient, you're still giving 1 milligram. Okay? It's packaged 2 and 2. All right, so it's a very common, and look what the math ends up being. 1 ml. That's how much you've got to draw up and give, right? All right, for that 10 kilogram patient. So a 15 kilogram patient is 1.5. A 20 kilogram is 2. So how much simpler is this to use than this Brazos, this length-based tape that we've been using for years? All right, when you're dealing with cardiac arrest, it's quick, simple, and very easy to go in. This is a hand-heavy system, and that's the handout I gave you. So you're looking at the 1, 3, 5, 7, 9, 10, 15, 20, 25, 30. You're very quickly able to go with your 1, 1.5, 2, 2.5, and 3 milligrams on your epinephrine or your Narcan, and 2, 3, 4, 5, 6 on your saline. That makes it very easy. So in conclusion, length-based tape is very difficult to use. Okay? It's very time-consuming. We can easily waste 2 to 3 minutes getting it out and trying to figure it out. As where this hand system is very quick, very easy to calculate dosages. So, do you feel like this is easier to use?
Yes.
Much easier to use? All right, any questions? You can stop, Mark. Yeah. Is that not simple?
Where's this been at?
Oh, yeah, you can stop.